Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Epidemiology changes at a rapid pace. Hi, I'm Dr. Sri Banerjee, and in this video I'll be going over just how rapidly epidemiology changes. So, when we're thinking about current events in epidemiology, it's really important to have agencies which have broad outreach. And what I mean by that is, for instance, within the United States, the Centers for Disease Control carries out the critical role of communicating very important public health findings. Similarly, globally, the World Health Organization serves to communicate any sort of emergent or any sort of happenings around the world. And this is known as Weekly Epidemiological Record. So this is similar to the MMWR, and this is known as the Morbidity and Mortality Weekly Report. But that is actually something that's handled from the Centers for Disease Control, more for the United States. So one thing that you'll notice here, immediately when you open this paper, is that you have not only an English version, but on the right hand side you're looking at a French version. So it's bilingual, which is actually very good because it appeals to a broader audience. So if there's Francophiles who are more well versed in French, then they can have that version. And recently I had the privilege of attending a UNESCO conference, and there both languages were spoken with interpretation. So let's take a look a little bit more at this record. For starters, this is very current as of the date of this recording, May 13th, 2022. And it's the 19th issue in 2022. So what are some of the topics that have been covered? One is vaccines against influenza, and this is the WHO position paper for May 2022. So you can go over that. And then when you scroll down further, you see an article, and then when you scroll down further, you see more about this topic and more on influenza vaccines. So there's typically a topic that is focused on, and then various age groups are explored. For instance, here, pregnant women and influenza vaccination is being studied, and as it's being shown, the pooled estimate from 3 randomized clinical trials conducted in low-income countries and 2 case control studies showed that the seasonal vaccine was protective against laboratory-confirmed influenza in pregnant women. And this is especially important during pregnancy because any sort of virus and anything puts a strain not only on the mother, but also on the child that the mother's carrying. So there's special considerations in here, and special topics that are explored, that you can just like we did here, you can just go in and think about some of the various subtopics that are extremely important to be thinking about. So for instance, vaccine safety, when you're thinking about vaccines, and I think the general population and general public have been a lot more well informed in vaccines in recent months, and of course within the last year, unfortunately due to the COVID pandemic. And so this is another example of where that vaccination knowledge, that acquired population level vaccination knowledge, that has been attained can be then applied here to better understand the administration of influenza vaccines. That's about it. There's of course consideration with Guillain-Barré syndrome, which is always important to look at and think about when you're thinking about safety of vaccinations, due to the fact that there is a possibility of crossing the blood-brain barrier. So these are all the different considerations that are pertaining to this. So in a nutshell, I think if we're trying to compare this with the Morbidity and Mortality Weekly Report, this is a little bit more of a detailed report on a specific topic, whereas the Morbidity and Mortality Weekly Report is more of a summary of various topics. So there you have it. This is a full paper, and it ends with a lot of good references, and also recommendations, research priorities, and that is important. That's something, and it's written in both French and English. But vaccine development and manufacturing is of utmost importance. The development of improved novel and universal influenza vaccines with increased breadth and longer duration of protection, greater effectiveness against severe disease, decreased time from strain selection to production, if annual vaccination required and well-defined correlates of protection. We're really looking for developing a stockpile that is really effective at the time of the infection, so that the vaccinations can continue to keep the infection rates low. And it's kind of an art trying to determine what specific strain is circulating and present within the population due to the biology of a virus. And then finally, also looking at the immunological evidence, and then ending with vaccine efficacy and effectiveness among target groups. So these are all the different areas to focus on. I hope you've learned something new from looking at this additional report. Thank you for listening.